Healthcare. It's all something we need to survive as human beings, alongside food, shelter, water, all that good stuff. Whether it's a routine physical, a dental cleaning, a pap smear, prostate exam, colonoscopy, you name it. But what happens if you have a medical emergency? Whether it's a stroke, a heart attack, an ulcer, you got shot, you got stabbed. Maybe this is when a nation's healthcare really gets put to the test. You drive yourself to the hospital, or maybe someone else drives you. Oh, no car? Call an ambulance. You get to the hospital, whichever way. They do whatever treatment, the doctors, they do whatever treatment they have to save your life. Your condition improves. You can now be discharged from the hospital. Weeks go by, and you receive mail from the hospital you were at. You open up the envelope. It's a bill for $50,000? What the hell is this? The ambulance ride, room and board, like it's a university, medicine, medical procedures, admission, supplies. Seriously, what is going on here? Yes, if you're in the US of A, this probably sounds all too familiar. So what's to blame for all this? I'll tell you what's to blame. It's those damn private insurance companies choosing to cover only a minuscule amount of hospital expenses or nothing at all. They don't have to cover anything. It's the fact that if you're under the age of 65, which is the minimum age you can have or be on Medicare, which is a form of single payer. But if you're under that age of 65, you're not guaranteed health care by the government. It's the rapacious for-profit mafia-like middleman insurance companies picking and choosing who and what gets covered. Wait a minute, is this legal? Indeed it is. Indeed it is. You see, insurance companies are so powerful, they pay off politicians on both the left and the right to ensure legislation leading to ensure no legislation leading to an expansion of Medicare to all ages ever gets passed. Well, as it turns out, having a system like this in place kills people. How many people, you ask? Well, how about 40,000 Americans, according to a Harvard study on this topic? That's how many Americans have been killed about every year, 30 to 40,000 give or take, depending on the year, from lack of health coverage, lack of healthcare access. So many parameters are placed there. Whether it's an emergency surgery, a treatment needed to save their life, there's so many ways this happens. And that's if you have insurance. Oftentimes, health insurance is correlated with your employment status. That is, if your job even provides health benefits. Not all jobs do this. But if you're unemployed altogether, oh boy, expect to pay twice or triple, even higher amounts than someone who is insured. But also, being insured doesn't give you immunity from going bankrupt and just going broke from all these medical expenses. As a matter of fact, that 40,000 death figure I brought up just now, oh, it went up massively as a result of the COVID-19 pandemic. It went from 400,000 to, it went from 40,000, to 300,000. As it turns out, if you throw a pandemic into this whole mess, it kills a lot more people. As many of you probably know, or maybe you don't know this, I'll say it anyway, the US was hit the hardest by the COVID pandemic. Cases, hospitalizations, deaths all hit a record number. Deaths are over 1 million, the highest out of all the other countries. 30% of these deaths could have been prevented if we had a Medicare for All system in place. So you put all this together, and basically what the speculation is, 300,000 Americans chose death over going broke, over having no money, over having to declare bankruptcy. And let me ask you this. Do you ever hear these stories, these horror stories of people being denied healthcare, people just dying in general because of this, coming out of countries such as Canada, New Zealand, Bahrain, Germany, the UK, Japan, Finland, Switzerland, Denmark, Australia, France, Netherlands, Italy, Spain, Iceland, Ireland, or any other country with a single-payer system? The answer is no. It doesn't happen. Do people in these countries get denied healthcare and die? Also no, doesn't happen. You know, even having a kid in the United States costs money. Being born in a US hospital is not a cheap thing to do. So for anyone considering having kids, or maybe you're pregnant and you're watching this, your girlfriend or your wife is pregnant, your mistress, whoever it is, friends with benefits, and you want to have a kid, you might want to book a flight to Canada and have a kid there. Maybe have a home birth, I don't know, but if you want that kid born in a hospital, yeah, maybe don't do it in a US hospital, unless you want to get billed up the ass. Now let's look at insulin prices in some of these aforementioned countries. So I'm going to list off countries and I'm going to say the price of insulin in US dollars. Australia, $6.94. The UK, $7.52. France, $9.08. Germany, $11. Canada, $12. Japan, $14. You want to know how much it is in the US? Wait for it, wait for it. $98.70. Wow. So if you're a diabetic in the United States, fuck, apply for medical asylum in any of those other countries, if that's even legally possible. It might not be. It's, you know how people flee from war-torn countries? Maybe that should exist for people fleeing outrageous healthcare bills. I don't know. Just a thought, just food for thought. And this is just one example. You know, this can apply to other medical supplies as well, or injections. Maybe dialysis might be the same thing. So after all this being said, do you still think our healthcare system works? Do you still think the for-profit, heavily privatized American healthcare system is a good thing to have in place still, after all I just told you? Because I sure as hell am not okay with this. I don't think it works. I don't even know if you can argue against it. Especially since, get this is the real kicker. A single payer system, so one where the government is the single insurer, it's actually cheaper to do that than the system we have in place right now, the for-profit one. So the question becomes not, can we afford to do it? It's, how can we afford not to do a single-payer healthcare system? Seriously, how can we not afford to do it? Now, obviously, I was born in a US hospital, but aside from that, I've had about 2 hospital visits, I think, that I can really remember. I got croup as a child when I was about 8 years old, and I thought I was very close to death. I was like, I couldn't breathe. I mean, it was nothing like COVID. It was worse than that because I thought I was gonna die. I was 8 years old. I didn't know croup was such a treatable ailment at that time. I didn't. I didn't. I thought I was gonna fucking die right there at 8 years old. Went to a hospital. Turns out I didn't. Obviously, I'm okay and alive and well. I was put on antibiotics afterwards. Less than a year after that, I strapped on a screw in my backyard when we were doing a slip and slide type party with friends, and I was put in the hospital for that. They tested me for tetanus. Didn't have that. I got vaccinated. So, and I think I remember asking my parents, like, if we weren't insured, we would have been fucked. So I wanted to make this video about just the horrors of American healthcare because it's all too familiar with people in those countries I just mentioned many times. But do Americans know this? I mean, a lot of them do, but there's a lot that just don't. There's a lot that only know what we have and they don't know it can be way better than this. This doesn't have to be reality. So think about this just in general. Just have a think about this. When you go to the polls, when you elect people, the midterms we just had, just consider this as part of a policy that we really could put in place